Hygiene. You need to be familiar with the reasons why we promote physical hygiene in our clients. Not only does it help with their comfort, but it helps with safety and well-being. It also helps improve health status. Functions of the skin include protection, secretion, excretion, temperature regulation, and sensation. There's two different layers to the skin. The epidermis shields the underlying tissue, and the dermis, which contains bundles of collagen, nerve fibers, blood vessels, sweat glands, sebaceous glands, and hair follicles. Subcutaneous tissue is tissue that lies just beyond this, or just beneath the skin. It's also known as the hypodermis. It contains blood vessels, nerves, lymph, and loose connective tissue that's filled with fat cells. Hygiene can be positive or negative. If it's too frequent, it can remove protective oils on the skin and cause the skin to be very dry and flaky. Feet and hands and nails require special attention to prevent infection. And the condition of a client's hands and feet can influence his or her independence. If they have poor foot condition, they're not going to be able to get around very well, and it can affect the way they perform their ADLs. Same with their hands. If their hands are not functionable, then they can't take care of themselves very well. The normal nail is going to be transparent, smooth, and convex, and it has a pink nail bed with a white tip. Disease, such as cardiac disease, can change the shape, the thickness, and the curvature of the nail. The oral cavity is lined with mucous membranes. Normal oral mucosa is going to be light pink, soft, moist, smooth, and not have any lesions. And due to a really rich blood vessel supply, injury can cause significant bleeding in this area. Saliva is very important because it helps cleanse the mouth and break down and moisten food. Medications, exposure to radiation, and mouth breathing can impair salivary secretion. Loss of teeth, injury, or infection can drastically affect health status. Xerostomia is dry mouth. Gingivitis is known as inflammation of the gums. And dental caries, or tooth decay, cavities. With the hair, hormonal changes, nutrition, emotional stress, physical stress, aging, and infection or other illnesses can all affect the hair. Sun, chemicals, hair products, permanents, straightening agents, coloring agents also can affect the condition of the hair. When you're cleaning the sensitive sensory tissues of the nose, eyes, and ears, you need to be doing it in a way that prevents injury and discomfort for the client. For example, taking care not to get soap in his or her eyes. When you're cleaning the eyes, you always clean from the inner canthus to the outer with a different part of the clean cloth to avoid spreading bacteria. And you never use the same area from one eye to the next. The sense of smell is an important aid to appetite, so it's very important to make sure that the nose stays clean. Always individualize a client's personal hygiene care. It's never routine. You start by assessing the client's preferences and what are their usual practices, and then you alter that practice as necessary to appropriately care for the client. For example, if they normally take a shower, does their condition eliminate taking a shower and instead they need a bed bath? Or should you use a bath in a bag versus soap and water? During hygiene procedures, then you're going to assess emotional status, health promotion practices, and healthcare education needs. And it's also a perfect time to begin to do a deeper assessment of areas that you may not see very well when they're lying in bed. Social groups can influence hygiene preferences and practices, including the type of hygiene products that are used and the nature and frequency of personal care practices. For example, teenagers all want to use the same type of shampoo because it's the most popular one out there, or the same type of body wash, etc. If you know a patient's personal preferences, you can help promote individualized care. Surgery, illness, or a change in emotional or functional status can often affect a patient's body image. Discomfort and pain, emotional stress and fatigue all diminish the ability or the desire to perform hygiene self-care and requires extra effort to promote hygiene and grooming. Now, when a patient lacks socioeconomic resources, it can become difficult to participate and takes a responsible role in health promotion activities such as basic hygiene. Patients' health beliefs can predict the likelihood of assuming health promotion behaviors such as maintaining good hygiene. Knowledge about the importance of hygiene and its implications for well-being will also influence hygiene practices, but motivation is going to be the key. People from diverse cultures will also practice different hygiene rituals. Do not express disapproval when caring for patients whose hygiene practices differ from yours. For example, my grandparents grew up in a totally different culture, and for them, of course, they're all gone now, but for them it was very normal for them to only bathe in the bathtub or the shower once a week. They did sponge baths in between, but a full bath was only allowed once a week. But it was the culture that they were raised in. And you can't express disapproval when you have someone that is raised in a different style of culture such as that. A patient's developmental stage will also affect the ability of the client to perform hygiene care and the type of care that's required. We look at the skin, for example, the sensitive neonatal skin, the active glands in puberty, or the skin that is thinning and drying as in the older adult. Looking at the feet and nails, dry skin or systemic disease, footwear problems or chronic foot problems. With the mouth, the teeth, are they teething? Do they have cavities? Do they have gum disease? With hair, are they shaving? Are they going through puberty? Are they aging? With the eyes, ears, and nose, all of those with developmental needs. Patients that have certain types of physical limitations or disabilities associated with diseases and injury might lack the physical energy and dexterity to be able to perform hygiene self-care safely. Acute and chronic cognitive impairments such as a stroke or a brain injury, psychoses, and dementia can result in the inability to perform self-care independently. As sensory deficits, they not only alter a patient's ability to perform the care, they can also place the patient at risk for injury. They're, for example, not able to feel the temperature of the water if it's too hot. If you look at box 39.1, it will show you some different cultural aspects of care or hygiene practices. Again, with the nursing assessment, make sure that you are assessing throughout the hygiene practice. Use critical thinking in your hygiene practices with your clients. This is a critical thinking model for hygiene planning. Make sure that you utilize the nursing process as you plan client hygiene. Assess what's required and what the client's preferences or routines are. Set priorities that are based on the extent of their problems and the nature of their diagnosis. You need to plan what equipment is required, what assistance is required, the location of the procedure, etc. In the hospital or extended care settings, then you'll be working closely with nursing assistive personnel because they're the ones that most often provide the hygiene care. You also collaborate with other health team members as indicated. For example, when I took care of a hip replacement client and I needed to wash their bath or wash their backside or their genitalia, then I would let physical therapy know that as soon as they had the client sitting or standing, that I needed to be in there and be ready to immediately do a quick scrub and maybe change sheets when they were out of the bed. When a patient needs assistance as a result of a self-care limitation, the family can often become a valuable resource to the nurse and also help with hygiene measures. If a patient's family member wants to assist with the bath, then a lot of times it's very appropriate and very helpful when they take on that responsibility. It also makes them feel important and makes them feel as though they're doing something to help their loved one get better. Implementation of hygienic measures will include gathering of the appropriate equipment and tools, preparing the client, providing assistance as required, providing privacy. You always encourage the client to be as independent as possible. One way I approached this was I would put the bathing supplies in front of the client. I would tell them, you wash what you can, and when you've gotten everything you can, then I'll help you get what you can't. Evaluate the procedure. Could something be done differently or in another, well, basically, could something have been done differently that would improve the outcome and or the client satisfaction? Make sure that you use a caring attitude to help reduce anxiety and promote comfort during hygiene procedures. Administer any medications for symptoms before hygiene. Are they uncomfortable? Do they need some type of pain medication? Also be alert for clients' anxiety or fear and assist and prepare the clients to perform the hygiene as independently as possible. Teach them techniques and signs of problems such as hand washing and its importance. Teach females that they need to wipe front to back only. Teach males how to cleanse under the glands of the penis. Teach what signs or symptoms might indicate a concern. Teach appropriate foot care, especially with diabetic clients. Teach how to clean the eyes from the inner canthus to the outer, again using a different part of the cloth. Teach cleansing of the ears where you don't poke anything into the ears. Teach cleansing of all creases and how to keep those creases dry. Teach them not to use oils in the bathtub. Teach the importance of hygiene and how it reduces bacteria and possibility of infection. Teach them how understand that all contact with the clients can be used for teaching and or providing information regarding whatever it is that you're doing. So always be on the lookout for teaching possibilities. Make sure that the clients know about community resources, especially if they're going home. What resources are available if they're not able to perform hygiene activities by themselves and they need assistance with a bath or a shower. Different bathing and skincare can include therapeutic, such as a sitz bath or some type of medicated bath or shower. It can be a complete bed bath, a shower, a partial bed bath. It may include the bath in a bag, where they have all of the moistened wipes that are disposable, that eliminates the need for soap and water, or then you have soap and water. Oral care is a part of hygiene, where you brush and remove particles, plaque, bacteria, massage the gums, and relieve unpleasant odors and tastes in the mouth. Flossing will remove tartar at the gum line. And then you need to rinse to remove particles and excess toothpaste. Clients that have special needs require conscientious, regular oral care. Excuse me. And some of the special needs would be like diabetes or artificial airways, the unconscious client, or clients that are undergoing chemotherapy. Hygiene also includes hair care. Brushing and combing. This helps distribute the oil and prevents tangling. And if you have a woman who has very long hair, and I guess some men in this day and age that have long hair, braiding helps eliminate tangling. I took care of a young lady who had some immobility issues, and her hair was so incredibly matted that it took me about 4 to 6 hours using a comb to actually get through all of the tangles in her hair. And then we were very conscientious after that to make sure that we kept it braided to help reduce any additional tangling. Make sure that you do obtain permission if you do anything unusual with the hair, or if it's necessary to cut it to remove some mats. You need to know the appropriate procedures for head lice. Shampooing. Shampooing can be done in the bed. And shaving. One of my pet peeves is men who obviously shave on a regular basis, and this activity, this hygienic activity, is ignored when they're in the hospital. Sometimes if that beard gets too long, then electric razors just will not work. If they are at a risk for bleeding, then you need to make sure that you use an electric razor. If a razor blade is to be used, make sure you soften that beard somehow. A mustache and beard require daily grooming, cleansing, and combing. Again, if a client looks like he's been growing a beard or a mustache, then it is not our decision to shave it off, so we need to help them take care of it. Know the appropriate care of the eyes, ears, and nose. With eyeglasses, make sure their glasses stay clean. If they have an artificial eye, if it's not implanted, then it has to be removed for cleaning with warm, normal saline. Again, appropriate ear care, making sure that we take care of hearing aids. These hearing aids can be easily plugged with earwax or cerumen. And nasal care, making sure that we do perineal care. Back rubs. Back rubs used to be a daily part of hygienic care, and clients were expected to receive at least a 10-minute back rub every shift. It also helps promote relaxation. And foot and nail care. This picture shows the appropriate care of dentures. Make sure that you have the cloth in the bottom of the sink. In case you drop them, it will help prevent chipping of the denture. And you always scrub the dentures with a toothbrush. This shows how to bathe the client's hair while they're in bed. There's particular tubs that are designed for shampooing hair. know appropriate shaving techniques. And I have never ceased to be amazed when I'm shaving a male client, even if they are very demented or have had Alzheimer's for years. They never forget how to stick that tongue in the cheek, etc., when you're shaving them. The procedure to remove the prosthetic eye, the different types of hearing aids. This one is an in the canal, an in the ear, and a behind the ear. Be familiar with the environment when you're getting ready to perform hygienic procedures. The beds, make sure that they are in the appropriate position. They have different features. You can raise them up so you don't have to break your back, and make sure that the side rails are in the appropriate position. Beds need to be clean, dry, comfortable, free of wrinkles, and in a safe position when you're through. When you make the bed, you can make it with the patient in the bed, with the patient out of the bed. Again, make sure the bed is at the appropriate height. Hold soiled linens away from your body. Do not contaminate yourself with potential body fluids by holding it against your body. Always leave that bed in the lowest position when you're done. In case the patient gets out of bed, it helps decrease the incidence of falls. And make sure that that bedside table and call light are within the client's reach before you walk out of the room. There are various styles of bed making for various needs. This shows some of the equipment that you may be asked to utilize. You have different foam boots or pressure relieving devices. This is how you hold soiled linens. This is what surgical or recovery bed it should look like. Not necessarily always the way it looks in today's world, but technically this is what it should look like. Excuse me. Make sure that you follow safety guidelines when you are cleaning or doing hygienic procedures. One of the most important things is to make sure that you always go from the cleanest area to the dirtiest area, and use gloves when you are assisting to bathe the patient.